Hi, everybody. It's Colin Hung here, editor at Healthcare IT Today. I'm excited to be talking to Dr. Ryan Van Wert, CEO and founder of Vynca Health. Welcome to the program today.
Great, thank you for having me.
Now, sir, I've got to say, first of all, thank you so much for all the great work you're doing, because I understand you are right on the front lines. You are still working at a hospital during this pandemic and everything that we're currently in. And of course, you're helping to run the company, Vynca Health, on the side. So tell us a little bit about that.
Well, I think it's been a remarkable several weeks for everybody at this point in any healthcare organization. A lot of the effort so far has just been on preparedness, and it has been great to see all of my clinical colleagues come together to prepare for this really exceptional, and I think many people would say once in a lifetime scenario. But having said that, it has been amazing to see how people have come together to solve these problems and to prepare for the situations that might arise. It's definitely been different in a lot of ways. The hospital now is a very quiet place, which is because a lot of our usual interactions have been moved to video visits, and again, with the aim of keeping people out of high-risk areas and complying with the social distancing. And also, of course, a lot of the elective procedures and otherwise that normally are representing a lot of the throughput of our healthcare system have all been canceled. So it's a very different place. It's an environment, I think, of being prepared and waiting at this point. Thankfully, where we are, at least in Northern California, is certainly that I think the social distancing and shelter-in-place orders were enacted at exactly the right time. And now that we're nearly 4 weeks into them in the Bay Area, we're definitely seeing the benefits of that in terms of hopefully now getting a handle on the disease, seeing the flattening of the curve, which has been really wonderful, of course, to see in our area in particular.
So I have to ask this question. So one of the things that COVID-19 has highlighted for many of us is that we really not had the end of life discussions with our loved ones as much as we should have. And unfortunately, I think one of the things that you and I were talking about before was, unfortunately, you're having to do that now right in the middle of that crisis situation, which cannot be easy. So maybe can you talk to us a little bit about that and what your experience has been over the last little bit around that end of life discussion?
Well, it's absolutely a critical part of managing the COVID-19 crisis. First and foremost, because we know that the people that are impacted most by COVID-19 from a morbidity, mortality perspective are those who are of a more advanced age and who have existing chronic conditions, and that's well established. And the crisis, I think, is one of these. We always look for and have to reflect on these crises as where are the ultimate opportunities that can affect good. And I think in this case, it is bringing to the forefront the reality that we all have to be reflecting on this. As much as there is a preponderance and a higher risk profile for people who are elderly and have multiple chronic conditions, the reality is that every single one of us living in a risk area for COVID-19 could be faced with decisions around life-sustaining therapy and our preferences related to that. And these are decisions that everyone over the age of 18 needs to be reflecting on and making and sharing with their caregivers, their clinicians, their loved ones. So, from this crisis, my hope and what we've seen is an urgency around getting these things in place. Advanced care planning and talking about end-of-life care is something that we're not going to sit down and necessarily do without a call to action. And there's a lot of ways that we can do that call to action just in normal life, through as clinicians and caregivers, through developing processes to make sure that goals and preferences are understood, captured, and honored. But this is a particular moment where there's a very clear need and where there's some very specific questions that need to be clarified for all of us about those scenarios we hope will never happen, but we have to be prepared for them. And the worst possible outcome is that something happens to someone, they get very sick with COVID-19, and they haven't had a chance to have their voice heard about what they would want in that critical scenario.
So can you maybe describe for us, just in terms of what in that, when you're in that kind of a situation where you don't have the advance directives discussed or on file from before, but what are some of the implications of that for the patient as well as for the family and the caregivers?
Well, I think that is the real challenge, is that often these decisions need to be made in a very short period of time, minutes to a few hours. And the implication to the patient is that often these individuals are in distress because they're critically ill. They're in no frame of mind and in no physical state to ultimately be thinking through a lot of these decisions on the fly and without any forethought to them. And then what it means for the family is that they're placed in this exceptionally difficult decisions of making what are frankly life and death decisions, and making them in that very short time frame without really knowing what their loved one wants. And I think all of us have reflected, and all of us in the community around advanced care planning have stories of when family members have had discussions with each other about their future care preferences, how often people are surprised by what that answer is. And it's often not what one might think a family member wants. And what that means is, in this acute situation, it's very difficult for the patient and for the family if those discussions haven't happened in advance. And of course, for the healthcare provider, to try and guide that patient and family with the best possible information, the best possible recommendations. This is where the patient voice really needs to be heard to formulate a cohesive plan that's going to best address that person from a physical and whole person perspective. And it puts providers, frankly, in a very, very difficult decision as well.
Yeah, it's often being said, when you do your end of life planning, yes, it is for you, and making sure that your voice and your wishes are honored and are listened to, but it's also for your loved ones, right? Essentially, by making the decision yourself, you're relieving a lot of guilt, frankly, from your loved ones of having to make that decision. Because if you have to make it in that sort of emergency situation where you're no longer have the capacity to do so, you can only imagine what kind of guilt that's going to put them on, no matter which they decide, right? And so, as much as we don't like talking about it, as much as it's uncomfortable, it is something that you should do just to relieve your loved ones of that horrific burden, should that situation come to pass. So, definitely with you in terms of moving as far upstream and as early as possible so you can have a frank, honest discussion so that everyone understands what you want.
Absolutely, absolutely.
So maybe just for our listeners and our viewers, can you maybe walk me through what a proper in your mind, what an ideal planning situation would be, or session would be like? When would it happen? What are you asking? What you should be discussing?
Yeah, well, it's a great question, and the answer is it depends. And what I mean by that is that we all need to be thinking about advanced care planning from the age of 18 onward. And when an individual is relatively young, healthy, you're really thinking about these emergency accident scenarios where there's an unexpected sudden illness, a trauma, or otherwise. And in those decisions, you're really trying to define who you want to be making decisions for you on your behalf. And again, it's one of those things where if people take the time to reflect on it, there may be very specific reasons why someone is a better substitute decision maker than another one. As people advance in age and maybe develop a chronic condition or two, this is where it's more important to be reflecting on values. What matters most in life? What represents high quality? What are things that are unacceptable scenarios? But It's ultimately a reflection on life philosophy and values, and that is something that is more abstract, but it's just about, where does my philosophy lie, rather than saying I need my philosophy and values now to be applied to a specific clinical decision. When an individual develops a serious illness, where there's a chance it may be life-limiting, or where there are very significant invasive procedures or treatments or therapies, that's what we refer to as more of a goals of care discussion, which is where you're taking those specific values, and with the care team, you're taking those and incorporating them into an overall care plan, i.e., when looking at multiple treatment options, which of these best address the overall goals of that person. And again, that is typically around a specific situation. So to answer the question, it really depends on where a person is with respect to life stage, with respect to specific medical conditions. But in general, it is best done when there's time. And it's best done when the people that really matter in that individual's life, when their clinicians are available to sit down, really reflect on the situation, reflect on decisions, and to make them. To your point earlier, that is really what relieves the burden later, when these decisions have been made up front, where values have been clarified up front. It makes it a whole lot easier for everyone involved when those difficult decisions around goals of care and how they align with treatment decisions come into play.
So your company, Vynca Health, it helps not only guide people through the planning process, but it helps to document it, what those wishes are and what the plan is, and then it helps to ensure that it's honored when that time comes. You've essentially systematized the end of life discussion and the end of life planning. How important is that to the overall delivery of health?
It's exceptionally important, and I think first and foremost because it offers a capability to normalize this as a part of clinical care, and ensuring, we hear a lot about patient experience, a lot about patient satisfaction. What that all really boils down to is, are you making this person's life better, and are you providing care and treatment options that are consistent with what matters most to them and what their real priorities in life are? So for both of those reasons, we believe and we support our healthcare organizations to drive an organizational change that ingrains this in multiple different workflows through the entire organization, looks for opportunities to standardize this process, whether it's during a Medicare annual wellness visit, other standard moments in care, offering the ability for patients to engage directly in this in a self-directed way. But it really comes down to driving that system level change for our partners.
And maybe can you walk us through a typical interaction with your platform and with your solution?
Yeah, absolutely. So we have a variety of digital tools that face either the patient and their caregivers or the clinicians, and it provides them with a rich and structured experience to make educated decisions and to implement standard processes for having these dialogues, so that the key components of every advanced care planning interaction are captured in a high quality, consistent, and scalable way. You can imagine that dropping a technology anywhere into healthcare is in itself an ineffective intervention. So a lot of what we do early on with our clients is a really in-depth partnership around clinical strategy, operational and change management that support them in their success. And then after we are live with a client, we're supporting them with regular reporting and with that ongoing consultation and advice, so that we see the most value from an adoption perspective.
Cool. This has been a very, very fascinating discussion. Where can people go to find more information about your company, you? Where would you point them?
Well, our website is vincahealth.com, and where we like to pride ourselves is on our outcomes and on the way that we've supported our clients to succeed in providing high quality care for their members and patients with serious illness. And we have a lot of supporting information where our outcomes in terms of reduced unwanted hospital admissions, intensive care utilization, decreased in-hospital mortality, increase in appropriate palliative and hospice service use, all of these things that are metrics for providing goal concordant care for individuals with serious illness.
Awesome. Thank you so much for taking time out of your busy day to be with us. It's, again, it's so important what you're doing. Thank you for everything you're doing. And I really do appreciate your time.
Thank you.
This is Colin Hung signing off from Healthcare IT Today. Thanks for listening.